Good morning, everyone. As we learn about the spatial senses, in that we completed about the olfaction, okay? Then taste, it means taste, smell, ears, okay? Now today we will learn about the vision, that is the sight. And we all know that our vision can be possible for our eyes, okay? So now today we will learn about the sensitive organ of our body, that is the eye. So vision, there are many supportive and accessory structure also associated with the main organ. Okay, so like surrounding the eyes, there are many some accessory structures like eyebrows, eyelashes, eyelids, okay, conjunctiva. There, these all are accessory structures. So from this, our eye can be protected from these all structures. Okay, so now we will learn about the vision, that is the eye. Accessory structures, eyebrows. So what is the function of the eyes? That is shades the eyes and prevent the perspiration into the eyes. So the perspiration can't go directly into our eyes, so eyebrows can protect our eyes and help for the shade of the eyes. Okay, next, that is the eyelids. What is the function of eyelids? Palpebral, protect of eye. Levator palpebral superior raises eyelid, and eyelashes, which triggers the blinking. We all know that the lashes are used for the blinking of eyes. And what is the function of lids? That is the protection of eye from palpebral, and levator palpebral also raises the eyelids. Okay, next, that is the conjunctiva. So mucous membrane over eyelids, anterior surface of eyeballs. Okay, so conjunctiva are situated at mucous membrane over eyelids and anterior portion of the eyeballs. Okay, that is the whitish part. So that is conjunctiva, and it is vascular when irritated eyes are bloodshot. So when our eyes are full up with bloodshot, in that case, vascular portion consists by the conjunctiva. Okay, so these all are the accessory structures of the vision. See, so as we learn about the levator palpebral and superior muscles, so see in this figure, so this is the levator muscles. Okay, this is the orbicularis oculi muscles. This is our eyebrows. This is the tarsal plate of eye. This is the palpebral conjunctiva. See, this portion is known as a palpebral conjunctiva. Then this is tarsal gland. Okay, some glands are also situated. This is the main portion of eye, that is known as a cornea. This is the palpebral fissures, eyelashes. Okay, this is lashes. Ocular conjunctiva, which is in bulbular shape. Then conjunctival sac hole, and last one, that is the orbicularis oculi muscle, same as upper, same as upside and same as downside. Okay, so both side, anterior and posterior side, it will situated. Then extraocular muscles. So here the diagram show for the extraocular muscles also and lens. So in extraocular muscle, movement is controlled by the 6 muscles. See in figure there are mentioned 6 muscles. First, that is the medial rectus. Second one, superior rectus. Third one, superior oblique muscle. Okay, this is okay, superior oblique, superior rectus, this line, and medial rectus. And posterior side, lateral rectus. See, here it is situated, inferior rectus and inferior oblique. Okay, so these 6 muscles control our eye movement, which is known as the extraocular muscles, and 4 rectus muscle, that is both superior and both inferior. Okay, so 2 oblique muscles, superior and inferior oblique muscles. And now innervation, that is the abducens nerve, trochlear and oculomotor. So three nerves are also innervation for these muscles. Okay. Then lens. So divided eye into anterior and posterior segment. We all know that eye divided into both segment, anterior side, front side and back side, posterior segment. So transparent flexible structure that can change shape to allow the focus of light on retina. So the lens is very important portion of the eye, because the whole focus of the light which placed on our retina, and by the help of that lens create an image on our eye. So it is a transparent, flexible structure that can change shape to allow the focus of light on retina. It is avascular and become less elastic through the light, causing focus impairment. Means in some case or due to some positive organism, our vision may be impaired. So in that case, it become less elastic, okay, throughout the life. And last one, the complication of the lens is that is known as a cataract. So lens become a cloudy. So due to the cloudy lens, we can't see anything properly. Okay, so cloudy lens due to thickening of the lens or diabetes. So in diabetes, this kind of the complication may be common, most common. Okay, so cataract is very common in diabetic client, and lens become a thicken, and due to that thickness it become a cloudy lens, and image may be blurred or impaired, so we can't see anything properly. Here the diagram of lens and eye shown in this figure. Okay, this is the sensory ligament, vitreous humor, that is the fluid which is helping for shifting movement, and this is the retina, this is the fovea centralis, and this is the optic nerve. This is the choroid coat. Okay, this is the sclera, conjunctiva, aqueous, pupil. Okay, so dilatation of pupil, contraction and retraction, it may helpful for the any bright light or too light. In that case, pupil can affect and may movement. Then cornea, this is the iris, this is the aqueous humor and ciliary bodies. Okay, so this is the diagram of the whole eye. So as we learned in previous slide, there are mainly 6 of extraocular muscles. So here the in table form, the nerve which control that cranial nerve, what is the action of that and what are muscles involved in this. So first of all, lateral rectus, which act moves only lateral side and controlled by the abducens nerve. Okay, then medial rectus, which act move medially only and controlled by the third nerve, that is the oculomotor. Superior rectus also controlled by oculomotor and elevated eye. Inferior rectus, which controlled by oculomotor, same again, and depress the eye. The main function of the inferior rectus is different, that is the depressed eye. Then inferior oblique, which elevated our eye and turns it lateral side. Okay, and which also controlled by the oculomotor now. Then superior oblique, which depress eye and turns it laterally, controlled by the fourth trochlear nerve. Okay, so this is the summary of that 6 extraocular muscles. Then further move on, lacrimal apparatus. So what is that? It consists of the lacrimal gland and associated with some ducts also. So it can help into the eyes. Lacrimal gland secrete the tears. So what is the main function of this lacrimal apparatus? The glands which collect and secrete the tears. So our tear formation can be possible by this lacrimal duct. Okay, so now Some details about the tears. So how it consists? It contains mucus, antibodies and lysosome. Okay, so tear contain mucus, antibodies and lysosome. Then it enters the eye via supralateral excretory duct. Okay, it enters into our eye via supralateral excretory duct and exits in from eye medially via the lacrimal punctum. So these two are the entry and exit side. Entry by supralateral excretory duct and exit by the lacrimal punctum. Okay. Then drain into the nasolacrimal duct. Okay. So the tears are drained into the nasolacrimal duct. So it also consists. So this is about the tears. See, in this figure, tear formation also shown. This is the lacrimal gland hole. This is the lacrimal sac. Okay, excretory duct of lacrimal gland, which means entry point, and lacrimal punctum. This is the exit point of the tears. So from this side, tears will be formed, and from this side, it will drain out of the eye. Then lacrimal canal. Okay, so via this canal, tears are come out from eyes and also associated with the nasolacrimal duct, means also associated with the nasal lacrimal duct. And this is the inferior meatus of nasal cavity and nostrils. Okay, so this is about the overview of the tears, and lacrimal duct are responsible for the tear formation, right? Then structure of the eyeball. So as we already learned in above previous slide, that posterior segment, which is known as the cavity and content of the vitreous humor, this is the scleral venous sinus, means canal of the sclem. It is known as lens. Okay, lens is the main portion of the eye. This is the anterior chamber of the whole eye, anterior pole. This is the pupil. Okay, iris, cornea, suspensory ligament, ciliary bodies and retina. In posterior side also, sclera, choroid, retina, macula lutea, it will be shown in here. Then fovea centralis, posterior pole of the eye, and optic nerve, which all control of the eye pressure. Okay, our intraocular pressure will be maintained by this nerve, that is the optic nerve. Okay, so main function of the optic nerve is the control of the intraocular pressure, and this is the optic disc. Okay, so overview or structure of the eyeball. Now fibrous tunic. What is that? Forms the outermost coat of the eye and composed of opex sclera and clear cornea. Okay, so anteriorly side it consists clear cornea, and posteriorly side it consists opex sclera. Okay, so by these two structure it will be formed, that is fibrous tunic. The sclera protect the eye and the anchors extrinsic muscles. So the cornea lets light enter the eye. So what is the function of sclera now? So opex sclera and clear cornea. So what is the function of sclera? Sclera which protect our eye and anchors extrinsic muscle. Okay. So main function of sclera is the protection of eye. And what is the function of cornea? Which means lets the light enter into our eye. So the main function of cornea means entry of the light in our eye. So this is the fibrous tunic. Second one, vascular tunic, which is known as a uvea. In further years or next year, you will learn about the disorder of eye. Okay, so in that case, disorder of all this kind of the structure, if it will complicated or affect in any sensory structure, then it may lead to the disorder of the eye and our vision may be impaired. So the basic anatomy will helpful for the understanding of the all kind of the structures. Okay, so vascular tunic, which consists three regions: choroid, ciliary bodies and iris. Okay, Vascular tunic, which known as a uvea, has a three region: choroid, ciliary bodies and iris. Now one by one we will learn what is choroid region. A dark brown membrane which forms the posterior portion of the uvea, okay, and it supplies the blood to all eye tunics. This is the main function of the choroid region, okay. It will appear in our eye, that dark brown membrane, and forms the posterior portion of our eye and uvea and supply the blood flow to the all eye tunics. Next region, that is the ciliary bodies, a thickened ring of the tissue which surrounding the lens and composed of the smooth muscle bundles like ciliary muscles. So ciliary body occur which appearance? A thickened ring which situated of the tissue surrounding the lens portion, and it composed of the smooth muscles bundle of ciliary muscles, okay, anchors the suspensory ligament that hold the lens in place. So the main function of the ciliary body, what is that? To supply the ligament and hold lens into the in place, okay, in actual place of the lens. And last region, that is the iris. So the color part of the eye is iris, okay, and pupil. Central opening of the iris is pupil. We already saw in previous figure. See, in this is the pupil and this is the iris. So central portion of the pupil is the iris, okay. Central opening of the iris is a pupil, which regulates the amount of light entering in our eye during which timing close vision and bright light. So pupils will be constrict, and distant learning and dim light pupils will be dilated. So this is the movement of the pupils, and by that movement we can show any image clearly and pupils will react on that. Like if vision is very close and bright light is there, then our pupils will be constricted, and if distant vision and light is very dim, in that case pupils will be dilated, okay. So the regulation of pupils will maintaining by this iris and entering in our eyes. So changes in emotional status. If person having the changes in that emotional status, in that case pupil will be dilated, and when the subject matter is appealing of require problem solving skill. So in that case also pupils will be reactive. Okay. So this is about the three region of the vascular tunic. Okay, so I hope you all understand till this topic. In this figure also the dilatation and constriction shown of pupil. So see, two types of muscles also involved for this movement, like dilatation and constriction. So see, in this first figure, parasympathetic stimulation causes the circular muscles to contract. So in this first figure, which stimulation occurred? That is the parasympathetic. And which muscles are involved? That is the circular muscles. So the movement will be easier and this will be happening, okay. And in second image, the sympathetic stimulation occur, which can causes the radial muscles to contract. So for dilatation, these muscles, circular muscles help, and for constriction the radial muscle will be helpful, okay. And which movement? Sympathetic stimulus will be happening for the constriction. So this is the main difference of the dilatation and constriction. So our pupil will be react any bright light and dim light or far object and near object. So in that case the muscles and this stimulation will be happening, and by this happen our eyes can react and any image shown in our retina. Okay. So till today's topic you all learn or revise this, and if you find any doubt you may ask in later session. Okay, so thank you everyone.